As a result of the continued spread of COVID-19, doctors are now recommending that we all get seasonal flu shots more than ever before. Good evening once again to you. I'm David Oliver. As part of our series, The New Normal, Color 10's Madison Heaver spoke with a local doctor about the two respiratory illnesses. Madison.
David, according to the Springfield-Greene County Health Department, the 2019-2020 flu season saw just under 4,600 cases of influenza. And as of today, the county has seen just over 4,800 cases of COVID-19.
Well, it's always important for people to get the flu shot.
Because of the COVID-19 pandemic, Dr. Scott Dooley with the Jordan Valley Community Health Center is recommending people get a flu shot now more than ever before.
This year, of course, we're going to have the overlap of COVID. I really want everyone to get it, but particularly people who are the most vulnerable. So there's been shown to be decreased risk of hospitalizations and death, particularly in the most vulnerable groups. So children, elderly, pregnant women, and anyone who's immuno-compromised or has chronic lung disease.
He says healthcare providers don't need to be overwhelmed with both COVID-19 and the flu.
And of course, we want to decrease the total demand on the healthcare systems because otherwise we could have overlapping epidemics of influenza and COVID at the same time, and so that's been a concern. With all the precautions that we're taking for COVID, hopefully we have a lower flu season this year as well.
As of today, there have been 1,700 deaths associated with COVID-19 in Missouri. And according to the Missouri Department of Health and Senior Services, there were just under 2,000 pneumonia and influenza-related deaths in the state for the 2019-2020 season as of mid-May. Dr. Dooley says if people keep taking precautions against COVID-19, this upcoming flu season may see less cases as a result.
So far in the Southern Hemisphere, influenza has been a lower rate than in the previous years, probably because of the social distancing, masking, and all those precautions that people are taking.
How can people tell if they have the flu or COVID?
Well, they really can't, and that's what we're going to need a test for, because there's going to be a lot of overlap with various respiratory viruses, whether it's colds or influenza or COVID. If you have a fever and cough, you should see your provider. We certainly want anyone that has symptoms to be tested. Whether or not they'll be more attuned to it, of course, I guess depends on the individual.
Dr. Dooley recommends getting your flu shot as early as the end of September and early October. And if you'd like to see all the flu and COVID-19 case information, you can find links to those dashboards on our website, ozarksfirst.com.